Hi, my name is George Shaler, and I'm the board president of the Justice Information Resource Network. This interview today is part of a JIRN series titled Justice Insights, Conversations with the SACs. I'm pleased to be joined here today with Thomas Strauss from the Idaho SAC, who's recently awarded JIRN's Douglas Yearwood Prize for its report called Sexual Violence in Idaho, Prevalence and Impact and Health Impacts. We're going to learn more about this exciting report in a second. Before we get started, I'd like Thomas to introduce himself. Thomas, please let the viewers know what your role is with the Idaho SAC as well.
Sure. Thanks for having me, George. My name is Thomas Strauss. I'm the director and principal research analyst at the Idaho Statistical Analysis Center. We are housed within the Pass-Through Grants and Research Department of the Idaho State Police.
Thomas, let me just ask you, what was the impetus for this project that resulted in the report? What was the research problem, policy question, or program need that you were hoping to address with this report?
Sure. So we've had a partnership with the Sexual Violence Prevention Program at the Idaho Department of Health and Welfare, and that partnership dates back to 2019. They're a small team with essentially 1.5 people on that team, and so they have little to no capacity to produce their own research reports. But they do have important data on sexual violence that provides more information beyond what our state's crime data can tell us. So for this project, their program manager came to us and said, hey, we can give you some of our data and a little bit of money to analyze it. What we need from you is a short report that is useful for practitioners in the violence prevention space and something that is easy to understand and provides actionable information that can inform those efforts.
Thomas, you've already kind of gone into a little of your methodology, but is there anything else about the methods that you haven't already addressed that you'd like to bring up?
Sure. So most of the data from for this report comes from the Behavioral Risk Factor Surveillance System, or BRFSS. So in 2020 and 2021, the SVP program had added questions to Idaho's survey on sexual violence around the state. And we were able to cross-tabulate some of that data with other data that survey collects around physical health, mental health of respondents, patterns in substance use, adverse childhood experiences, or ACEs. And so while the research brief was mostly focused on that BRFSS data, we did also pull in a little bit of crime data and victim services data to add some context to that.
Great. Thank you. So Thomas, can you give me a sense of what were some of the key findings with this report?
Sure. We essentially had 4 key findings for this report. The first is that about 13.5% of adult Idahoans have experienced sexual violence at some point during their lifetime, which is a much higher rate than data from those other sources would suggest. In 2021 alone, the BRFSS data shows us that about 13,000 adult Idahoans had experienced unwanted or forced sexual contact within the 12 months prior to taking the survey. And we compared that to the nearly 4,200 adults who received services through a federally funded victim service program for sexual assault or abuse that same year, or just the 685 who reported that sexual assault to law enforcement. So the BRFSS data tells us that sexual violence is far more prevalent than we had previously thought. Second, BRFSS data also tells us that about 13.5% of adult Idahoans have experienced childhood sexual abuse. The most common type of abuse was being touched sexually by an adult, and we estimate that this applies to about 12% of the population. And while it was the least commonly reported type of abuse, we also estimate that 5% of Idaho adults were forced to have sex with an adult while they were children. And again, these estimates are much higher than both our state's crime data and victim services data would indicate. Third, some segments of the population are disproportionately impacted by sexual violence. These include people between the ages of 18 and 34, those who are income restrained using the United Way's ALICE definition, females, and those who are part of the LGBTQ plus community. All of those groups reported experiencing sexual violence at higher rates than those outside of those groups. And finally, those who have experienced sexual violence at least once in their lifetime were found to be more likely to face additional physical and mental health related challenges. These included poor current mental and or physical health, regardless of how long ago the assault or the abuse occurred, higher rates of drug or alcohol use, and additionally, those who had experienced sexual violence also had higher rates of other ACEs beyond childhood sexual abuse. And those could include experiencing emotional and or physical abuse, exposure to alcohol or drug abuse in the home, having an incarcerated household member, having a household member that struggled with poor mental health, and parental separation or divorce.
Wow. Wow. So, Thomas, what's the key steps going forward? Like now that these data have been collected and you've put out this report, what are the programmatic or policy decisions in Idaho that are anticipated?
Sure. So we drew kind of two main conclusions from this analysis that we think have impacts for policy and practice. The first being that sexual violence in Idaho is extremely underreported. Nationally, we know that roughly a quarter of sexual assaults are reported to the police each year. But the data we analyzed for this research brief suggests that the reporting rate in Idaho is probably even lower than that. And this means that unless we are conducting regular population surveys that ask about people's experience with sexual violence, we will continue to underestimate the true prevalence of sexual violence in Idaho. Our second conclusion was that a substantial portion of the adult population in Idaho, again, between 13 and 14%, have experienced sexual violence at some point in their lifetime, with certain demographic groups seeing even higher rates than that.
Yeah.
And people who have experienced sexual violence are more likely to be affected by that wide range of adverse mental and physical health conditions, which we think highlights a need to strengthen Idaho's capacity to both respond to sexual violence when and where it happens, and most importantly, to prevent it from happening in the first place. Strengthening our sexual violence prevention and response programs around the state will help ensure that those services are available to those who need them the most, will help reduce the harm experienced by survivors even later in life, and prevent future incidences of violence from occurring, which we think should help improve public health and safety for all Idahoans.
Wow, Thomas, this is a great report, and I think it provides a model for other states to kind of look at, taking in the BRFSS data and looking at the impact on the criminal justice and victim services communities. So I wanted to thank you for this report, congratulate you on it, and we'll look forward to hearing more about this going forward from you and folks in Idaho.